Hey everyone, and welcome to This Explainer. Today, we're diving into something absolutely crucial. We're looking at the fascinating mechanics of how our bodies actually process sugar, and well, what happens when that microscopic system hits a roadblock. We're going to unpack exactly what diabetes is, step by step, straight from the source material. So, let's get right into it.
Okay, let's dive into this. Because right off the bat, we need to ground ourselves in a really important reality. If you have diabetes, you are absolutely not alone. Literally millions of people today are navigating this exact same condition. And, while it can definitely feel overwhelming at first, our goal today is to totally demystify the whole thing and break down exactly what's happening inside the human body.
So to really understand diabetes, we've got to start with how we get our energy in the first place. When you eat, your food is broken down into sugar, or glucose, which then travels right into your bloodstream. But here's the catch. It can't just stay there. It actually needs to get inside your cells to give you energy. Enter insulin. This is a crucial hormone made by the beta cells in your pancreas, and its whole job is to help that sugar move from your blood into your cells. Without it, the sugar just builds up, and your cells basically starve.
To picture how that actually works, think of it like a giant lock and key system. The walls of your cells have these little receptors, right? Those are the locks. Insulin is the physical key that fits perfectly into those locks. When it turns, the cell opens up and the sugar from your blood is finally allowed to enter and fuel your body. Honestly, it's an incredibly elegant, highly coordinated system when it's working right.
But, insulin doesn't work totally alone. There's actually a whole supporting cast of hormones keeping our blood sugar perfectly balanced around the clock. On one side, we've got glucagon. That's made in the pancreas, and it tells your liver to release stored sugar when you haven't eaten for a while, like, say, when you're sleeping overnight. Then, on the flip side, we have GLP-1. This is a hormone made in the gut that steps up when you eat, telling the pancreas to produce the exact right amount of insulin, while also lowering the amount of sugar made by the liver. It's just a constant, incredible balancing act happening entirely behind the scenes. Now, what's really interesting is how that lock and key analogy perfectly highlights the difference between the two most common types of diabetes. In type 1, the body's immune system actually attacks those insulin-producing beta cells in the pancreas. The result? You literally have no keys to open the cell doors. But in type 2 diabetes, you run into a completely different problem called insulin resistance. The keys might actually be there, but the locks have completely changed shape, so the insulin just can't fit into them anymore. Either way, the end result is exactly the same. The sugar gets locked right out of the cell. And when we look at the numbers, one statistic really stands out, and that's 90%. About 90% of all people living with diabetes have type 2. This specific kind usually happens in folks who are a bit older or who are overweight, where that insulin resistance gradually builds up over time, and the pancreas just can't keep up with the demand.
Contrast that with type 1, which is usually diagnosed much earlier. We're talking usually around age 12, though it definitely happens in young adults too. Because the body's immune system has actively killed off those beta cells over a period of months or even years, and get this, often without any pain or symptoms at all, these individuals make little to no insulin. So because the pancreas simply can't do the job, people with type 1 absolutely require daily insulin to survive. So what actually happens to your body when those cells are locked and the sugar is just trapped out in the bloodstream? Well, you get hyperglycemia, which is just the medical term for high blood sugar. And the signs for this are pretty widespread. Because your cells are literally starving for fuel, you might feel extreme hunger, serious fatigue, or have unusual weight loss. Your body also tries to flush all that excess sugar out, which leads to frequent urination and intense thirst. Over time, all that sugar building up in the blood can severely harm your blood vessels. We're talking potential for blurry vision, slow healing wounds, tingling hands and feet, and even heart disease, blindness, or kidney failure if it's left unchecked.
On the totally flip side of that, we have hypoglycemia, which is when your blood sugar drops dangerously low. Now, this can happen for a few reasons. Maybe you skip meals, eat too few carbs, do some really heavy physical activity, or maybe take a bit too much insulin or diabetes medication. The symptoms here are a little different, but just as urgent. You might get sudden hunger, start feeling nervous or shaky, maybe you're sweating, dizzy, super sleepy, or even feeling totally confused. It is essentially your body sounding a massive, immediate alarm that it needs fuel, like right now.
If that alarm does go off, you need an actionable rescue sequence. And the American Diabetes Association recommends a very specific 3-step process for this. Step 1, immediately eat or drink 15 to 20 grams of fast-acting sugar. Think 4 ounces of regular juice or soda, or maybe a couple tablespoons of raisins. Step 2, wait exactly 15 minutes, then check your blood sugar again. If it's still low, repeat step 1.
And finally, step 3. Once your levels actually return to normal, make sure to eat a full meal or snack. That keeps the low blood sugar from just crashing right back down. It's a really simple, highly effective checklist to keep in your back pocket.
Let's move to the next piece of the puzzle and see how this builds into taking back control of your health. Managing diabetes means monitoring your levels really closely, and that means knowing exactly what you are testing. You'll hear a lot about fasting blood glucose. That's your baseline sugar level taken after not eating for a solid 8 to 12 hours, so usually first thing in the morning. Then there's postprandial glucose, which is basically just your blood sugar measured 1 to 2 hours after a meal to see how your body handled the food. Tracking these numbers in a daily diary, that is exactly how you figure out how food, stress, and exercise actually affects you.
Now, daily testing gives you the play-by-play, but how do we zoom out and see the whole season? That brings us to a really pivotal question for anyone managing their metabolic health. What in the world is an A1C test?
Well, think of the A1C test as a sort of historical record. It measures your estimated average blood sugar level over the past 2 to 3 months. While those daily finger pricks show you a single snapshot in time, the A1C acts as a true memory of your blood sugar levels. It shows you and your doctor how well you're actually controlling things over the long haul. And your A1C and those daily blood sugar levels naturally go up and down right alongside each other.
So the crucial point here is this specific magic number, 7%. For most people, keeping that A1C goal below 7% is the main target. Why? Because lowering your A1C dramatically reduces the risk of those severe, long-term problems we talked about earlier, like heart disease or kidney failure. Consistently hitting this number essentially means your overarching game plan is working.
Okay, but how do we actually hit that number? By building a really comprehensive diabetes care plan. And it's not just about taking insulin or medicines. It is a full-on lifestyle strategy. It involves eating a carefully planned diet, getting in regular physical exercise, managing your blood pressure and cholesterol, and in some cases, maybe even taking a daily aspirin. Keeping that blood sugar diary we just mentioned is absolutely essential here because it lets you see exactly which parts of your daily routine might need a little tweaking to keep your levels in that normal range. And I really want to emphasize this. You do not have to build or manage this plan all by yourself. It literally takes a village. Your care team is a collaborative network designed specifically to help you succeed. This includes your primary doctors, for sure, but also eye doctors, nurses, specialized dietitians, and even foot doctors. They are all working together to protect the different systems of your body from the effects of high blood sugar. Which leads us to our final thought for this explainer. Diabetes cannot yet be cured, but it can be managed. It definitely requires attention, daily tracking, and a rock-solid care team, but ultimately, you hold the keys. By understanding the core mechanics of insulin, recognizing those immediate symptoms, and actively managing your care plan, you can totally take control of your health journey. So looking at everything we've uncovered today, how are you going to use this knowledge to master your own metabolic health?